So this should help with the motion of hip flexion on our standing hip machine out here. I'm going to get rid of some of these guys that do participate in the motion, just so that we can get a sense of exactly where we want to be feeling this, if my cursor will show up at some point. There it is. Let's just go like this. All right. So now that I've gotten those to hide after too much trouble, what that should do is help us get a little bit more of a concerted effort to try and get this area of muscles to feel like they're working. So while this is a little bit different than in the machine because your knee won't remain straight the entire time, what I want you to see is the arc of motion here. So at the beginning of the motion, we're trying to push forwards with the knee when it's at the beginning. And then as it begins to come up and around, we're pushing in an ever-changing series of straight lines around this arc until you get a little bit more up in this direction, which this visual doesn't make it quite that far. But we are not, in red, just pushing straight forward the whole time. And we are not just pushing straight up the whole time. It is this blue, ever-changing series of arcs is what we are trying to accomplish. Now let's let this sucker play. Moving tangentially around this arc, nice and smoothly. Your lower leg will bend, which will allow you to get a little bit further into the motion as opposed to in this visual, but kind of traveling around this arc. Really trying to do our best to find these muscles here as the ones that are working. These hip flexors, your iliacus, your psoas, maybe a little bit of pectineus, but trying to get this area right in between where your pelvis and your femur kind of come together as the area that we're trying to use to move our leg up in order to lift that thigh pad up and around the corner. So one more time just to zoom out so you can get a picture of that. That nice arc of movement that we're trying to go around. And another important thing that you need to keep in mind here is that this pelvic girdle up here does not move. It stays fixed, except for at the very top of the motion, you might get a little bit of it tilting, like your waistband is kind of coming up towards your sternum. You might get a little bit at the end of it. This comes up and around, and then a little bit of a tilt here. But we don't want it to be the case that our pelvis is shooting back this way, or we're trying to push it forward to move the weight up and around. That should pretty much stay locked in, keeping your core engaged to make sure that happens as you lift that leg forward and then up and around the corner. And then at the end, you might get a little bit of a pelvic tilt backwards, or pelvic tilt upwards. Not that we're letting everything shoot back this way. We're just trying to tilt up and around a little bit, maybe at the end. If you don't end up getting that part, that's totally fine as well. However, if you get a little bit of it, that's okay. It's not going to be the end of the world or the end of your hip joint. Keeping in mind that this pelvis up here does not move at all. It stays in one place, locked in pelvis. Come on. Pelvis locked in, moving around that arc nice and smoothly. Should be able to feel this section of muscles. Oops. This section of muscles right here on the front is what is responsible for moving these muscles up and down. So primarily these guys kind of up into the core a little bit. Psoas, iliacus, those. If you feel a lot of kind of engagement on the outside front of your hip here, then make sure you talk to me so we can get that to not happen quite as much. We want to get as much as we can these muscles that run right down in here over this area and this little gap. And that's what you want to be doing on the hip flexion exercise.